I'm an active person. I have a large property and I maintain it, which always involves trimming trees and lifting, and I do things that young men do. So that's what I want to be back to. And I have friends who have come here, one of whom is a PT herself, and she said, oh, you need to go to core. Okay, so I need to go to core. And I met Troy, and he immediately did things differently from the previous PT. And it started with a little visit to the skeleton, where he showed me in very, very tactile terms what had been done to my left shoulder, and then helped me understand where I needed to go. So we got off to a great start, but then, you may remember, COVID hit. So I was out because the practice was closed, and I was out. I did ultimately get back for something, but his explanation of things helped me, and I could do a lot on my own. It took me a year to get back to what I considered to be full function. I did get full function, but it took a year. And a good part of that year was excruciatingly painful and uncomfortable. I won't take a pain med. So I endured that initial period of time when it hurt, but I also didn't like not being able to buckle my pants. You know, like that is a real drag. And so fast forward a few years. Recently, I started to feel a strain in my right shoulder that felt eerily similar to what I had felt in the left shoulder. And I thought to myself, I'm headed for another rotator cuff repair, and I do not want to do that. So once again, we started the skeleton, and he shows me what, in his opinion, needed to be done. And it started with a rib attachment in the back. And he said, we're going to work, and we're going to try to get that back where it needs to be. And then we're going to do some other stuff. I can't remember all of it, and I certainly don't know the technical terminology. But little by little, I started to feel some improvement. It was slow and incremental, as these things are. But I was bound and determined to not go through another surgery. I didn't want it. So after, I don't know, a few months, you know, I sit in the waiting room and I see the video, and I was curious about it. I've heard this machine, and the first time I heard it, I asked the cat, I think it was, what is that? It sounds like construction. She said, no, that's the stem wave. Really? Oh, okay. So I asked Troy about that, and he said, you know, I think you would be a good candidate for it. And what he had observed over however long he'd been treating me, he said, I think this would work, or at least will help. So I bought a course of these treatments, and I was fascinated by them. You know, I'm curious about this stuff to start with. And so we did it as prescribed. I think it was 3 times a week, and then a couple times a week. And we tried to get it so that it all fell in a month period. And sometimes I would walk out of here and I was sore because the treatment was sufficiently intense but that didn't last long. I mean, by the end of the day, I would be noticeably better. I could feel the difference. Now, mind you, when I started in with Troy, I had trouble doing this. It's not that I couldn't, it's that it was really hard to do it. And after a period of time with him doing some physical manipulation and then 10 sessions with the machine here, I've got full everything. And it's not just movement, it's strength as well. Like I can do the odd shaped things that I simply couldn't do before. It's not 100% pain-free, but I'm also pushing myself in general beyond what a lot of people my age do. That's enough for me. But the long and short of it is that the total course of therapy that included a month of this fixed me. And I'm really grateful for that. It saved me from difficult surgery. But that's what I love about core PT, is that there's a belief here that your body can be restored. Okay, and I think I'm proof of that.